All right, I'm going to go ahead and kick us off. Very excited to have everyone here today. Good morning. My name is Thomas Winkel. I'm the director of the Arizona Coalition for Military Families. Welcome to the 12th Annual Statewide Symposium in support of service members, veterans, and their families. 12 years we've been doing this. It's really quite remarkable. This is our second virtual statewide symposium, and by hook or by crook, it will be our last virtual symposium. We love the medium. It's been fantastic, but we are looking forward to being with everyone, shaking hands, giving some hugs, and doing some high fives as well. And we will be doing that next year for sure. But we appreciate everybody joining us. I am a United States Marine that served in Operation Desert Shield, Desert Storm as a combat infantryman. I have the honor and privilege of being your MC today. Today's ceremony will consist of the national anthem, which will be sung by Navy veteran Garland Miller. And then we're going to take a moment of silent reflection. So ladies and gentlemen, the national anthem.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave.
Thank you, Garland. That's 12 years in a row. Next year is Baker's dozen. Outstanding job. We always appreciate you. So now I'd like to just take a moment of silence for those we've lost over this past year, those who are hurting, those who are struggling, and really, reflecting upon them. But I also want, or would encourage at least, everyone to think about the joys, the successes, and some of the demonstrations we've all had throughout this year of the best of humanity. Please join me in a moment of silence. Thank you and welcome back. We appreciate you all. I want to introduce you to Navy veteran Dee Person. She is our community engagement and program manager for the coalition and the symposium planning team lead. She and her team made this happen. And without them, you'd be staring at a blank screen and you wouldn't get the opportunity to listen to all the wonderful speakers we have lined up today. So Dee, take it away.
Thank you, Thomas. Good morning. This was truly a collaborative effort. I want to thank first my team, the community engagement team, and I'd also like to acknowledge our partners and planning team committee, who pulled together in order to create the best possible and most engaging two-day virtual event for all of you. Each planning team member challenged the committee to dive deeper into the topics that are most important to our service members, veterans, family members, and caregivers. The symposium topics that you will actively participate in the next 2 days came directly from our community network meetings that we hold quarterly for our military connected champions and organizational leaders. In these meetings, we collaborate and problem solve issues affecting our military connected community members. Well, today you'll have that same opportunity for you to voice your opinions, for them to be heard and share your ideas. Thank you again to our 2022 Symposium Planning Committee for your time, persistence, and patience over these last 7 months. I'm so glad that you were patient with our team, and thank you for not blocking me. All right. I'd now like to thank our sponsors. A special thanks to our event sponsors, our title sponsors, the Arizona Department of Veterans Services, and the VA healthcare system. I'd also like to thank our partner sponsors, Mercy Care, Tri-West Healthcare Alliance, and Arizona Partnership Services. Next, I'd like to thank our supporting sponsors, Solari, Honor Health, Banner University Health Plans, Blue Cross Blue Shield Arizona, the NARBA Institute, Molina Healthcare, and AARP Arizona. Thank you so much for supporting us and making this day happen. I'd like to now turn it back to Thomas.
Hey, Dee, thanks very much. Appreciate that. Yeah, to all our sponsors, we really appreciate everything that you do. That helps us be able to do a lot of amazing things in the community. And so it's a great relationship, and we appreciate that. So, okay. Be Connected is Arizona's response to the federal clay hunt suicide prevention for American Veterans Act from 2015. I don't know how many of you folks know this, but Mr. Clay Hunt was a Marine. He died by suicide despite actively seeking care for his post-traumatic stress disorder. The late Senator John McCain advocated for Arizona to be a pilot program site for this act because he knew that Arizona needed it and that we could do something special with it. So let's take a look at the past 5 years.
In 2016, the rate of suicide for Arizona veterans was 3 to 4 times higher than the general population. Despite the efforts of many, we were losing ground on veteran suicide. It was time for a different approach to create a different outcome in the future. The result was an unprecedented partnership that reached across sectors and focused on upstream prevention. Arizona's Be Connected program launched to serve, support, and connect Arizona's 500,000 service members, veterans, their families, and communities. It started small, just one person answering the Be Connected support line. In the first 2 weeks, the phone rang 5 times. It took 18 months to reach 5,000 Be Connected encounters. It took only 6 more months to reach 10,000 encounters. And 5 years after launch, we've reached 75,000 encounters, all provided by our Be Connected team, which has grown from 1 to more than 50. We've built a nationally recognized ecosystem of support with hundreds of organizations, thousands of people, and over 3,000 resources. Be Connected impacts lives every day. Together, we've built a foundation, navigated challenges, and now look to the future. Join us in expanding our impact. Join us in furthering innovation and prevention. Join us as we help Arizona's service members, veterans, and their families to be connected.
So we hope that we've honored Clay's loss through our collective effort. We hope that you are encouraged by the progress that we've made so far, and that you will renew your commitment as we move into the next phase of Be Connected. Those 75,000, on average, we have about 5 referrals, 5 connections, 5 ways of navigating for each and every person. So if you total all of that up, that's around 375,000 referrals that have come out of navigation opportunities. experiences, connection to resources. It's really quite remarkable when you think about it in those terms. We're very proud of the team and everything that has been done here in this state. And I'm just going to bring in that this really should come as no surprise to everybody or to anyone that knows Colonel Wright, but she's been with us since the very beginning. She helped shepherd the Be Connected program into what it is today. She works tirelessly to ensure that Arizona remains the best state for service members, veterans, and their families. So please join me in welcoming Wanda, the director of the Arizona Department of Veterans Services. Wanda.
Thanks so much, Thomas. Just a little bit about me. I'm an Air Force retiree. I was 26 years in the Air Force, 5 years active duty, and 21 years in the Arizona National Guard. Go Air Guard. And I'd also like to give a quick shout out to the planning committee. We have a couple of members from the department on it, and already this feels like it's going to be a great couple days. So thanks you guys for putting together such a great event. Thomas asked me to sort of reflect on the last 5 years, and I try not to get emotional about it because, you know, it's a wonderful program and it's helped a lot of people over these 5 years. And we've come a long way since the first 5 telephone calls into the system. And I don't know if, I feel like a lot of you were here when we launched it at the symposium, and how, you know, it's a wing and a prayer when you first start a program and you hope that it's going to be successful. Thomas talked about Clay Hunt, and that was the beginning of the idea. We were able to sort of transition into the mayor's challenge and the governor's challenge in our proactive effort to keep alive a suicide prevention program. And through those 3 sort of events, we were able to create Be Connected as a collaborative. And what's important about that collaborative is the partnerships that we put together in order to make what was I think, an awesome idea, and with the will of the partners became an actual program. And then, you know, through the years, the program became a national best practice. You know, the New York Times, we were asked to come to the White House to speak about it. We were technical assistants to other states to help hone their suicide prevention programs. And it's just been a joy to be a part of this entire sequence of events that have brought us here today to talk about Be Connected, to include the Be Connected community networks that started off as an idea as CVEBs from the VA. And we, as we do it the Arizona way, we made them our own. And now we have these 3 regional boards or teams that really talk about what's happening across the state of Arizona when it comes to service members, veterans, and their families. And so, you know, I'd like to thank all the partners who over these last 5 years have just been, you know, gracious and generous with their time, the 3 VAs, the VARO, Tri-West, the National Guard, Access, we love Access. You know, and all the other multiple partners that maybe didn't have a major part in it, maybe had a little more minor part, but, you know, we needed everyone in order to get this thing off the ground and moving in a direction that actually help people. So you count them, 75,000, that's a lot of encounters. And we hear the stories of these encounters, of how we've saved lives. And through early intervention, we'll never know how many, but we do know that we've been able to reduce the barriers to access. And that's really the bottom line motto for our department. And that's why I'm so proud of this program, because that's what it does. It reduces barriers to access for people who are homeless, for people who are unemployed, for people who need financial support, for people who need help understanding their educational benefits, for people who need mental health care and physical health care. Be Connected is now the resource navigator for all of the service members, veterans, and their families, to be able to reduce the barriers and to get access to those resources that will help them have the quality of life that we want for every one of them. So thank you to everyone, and let's keep moving Be Connected forward. Thank you.
Oh, Wanda, you're so awesome. Thank you so much. I'm holding back my emotional response. You're just an amazing partner. I'm so glad the Arizona Department of Veteran Services has you. So glad the state has you as the #1 veteran in the state. Just thanks. Okay. All right, folks. Look, I think about what I want to say to everyone in my 5 to 10 to 15 minutes every year. And this year really is no different. But I knew exactly what I wanted to say. What I wasn't sure of is whether or not I was going to be able to communicate it well enough. So help me if you can to really try to hear the words that I'm speaking, and challenge them if you think they need to be challenged. Agree with them if you think they need to be supported, and but I hope it comes across in the right way, because I think all of us have experienced what suicide feels like, and I think if it were one of our collective wishes, we would do away with it. Given the fact that we don't have a magic lantern, we've just got to put our, roll our sleeves up and put our muscle into it, if you will. So this year, I'm going to speak to you a little bit about the path forward that we have in front of us. So, here we are. We're 5 years into Be Connected, an amazing partnership. We're taking a different approach. We're working towards a different outcome. And we came together, we stood up, we nurtured and grew Be Connected. We weathered 2 years of a pandemic that required all of us to change most everything. And now, I don't know about you, but I'm ready for the next 5 years. So a key aspect of Be Connected is to be an open door to all the resources, services, and benefits that are available to cover all aspects of life. Listed here are what we call the social determinants of health. They are called that because each of these separately and in combination have an effect on our overall health and wellness. If a person struggles in one area, it can definitely cause stress. If a person struggles in several areas or even most areas, it can be a moderate to severe burden for them and their family and have an impact on all the other areas, including physical health. There is a cascading or an avalanche-like effect that happens with these things. I've met very few people who have struggled in only one area. I have been practicing as a therapist in social services for over 30 years. And I can tell you that while I was very good at what I did, when the client's success was disrupted, it was disrupted by social determinants. Think of your own life. Which of these areas are you doing really great in? Which of these areas could honestly use some improvement? The ones we don't want to think about, right? How do they affect each other? If we don't have the right level of education because we're not able to, concentrate well enough because of other mental health issues, then that's going to affect both finances and our employment and possibly our social support system and maybe even our family. They all tie together in a very complicated way in people's lives. If you are like most of us, it doesn't make you feel good to be struggling in any one of these areas. So we created a comprehensive way that service members, veterans, and their families, social workers, peer supports, and anybody interested in supporting veterans can utilize resources to improve each area. That's Be Connected. That's what's so exciting about it. So in your role, you may or may not have a direct view of how the social determinants of health impact people's lives. Here are a couple of examples from my own travels. I met a man in Flagstaff, Arizona, while working in a homeless outreach directly after the Marines. He said to me, I have an animal I love, and that helps me maintain my mental health. And you want me to go to a housing where they can't come? That's a no-go. What this individual actually needed was pet-friendly housing. It didn't exist back in 92, 93, 94 when I was doing this type of work. Possibly veterinary services and expanding his social support. A colleague of mine had this situation. My PTSD symptoms leave me feeling confused and tired, but I have to get a better job for my family's future because we're fighting all the time. For this situation, we needed to take into account mental health, yep, employment, yep, family counseling, family education, family support, somewhere along those lines. It starts to get complicated. My best friend's mother had this issue. My best friend was the guy I served in the Marines with. So she was like kind of my Marine military mom, if you will. She said, as a caregiver, I can't leave my spouse for even a day. And given his situation, I can't have anyone over. How do I have friends or go to worship services? So I used Be Connected to plug her into benefits and how to increase access to social and spiritual support. Life changer. Another person contacted me out of the blue, so I assisted with a referral to Be Connected. They said that my debt is crushing, my finances are a mess, and I can't pay child support. So we needed to work with them and figure out like, okay, we'll start getting them budgeted. We got to do financial assistance, employment, education, upskilling, and also work on legal issues for family court. What we know is that over time, these types of issues, they take their toll on the individual. They take their toll on the family and even in the community. None of the people I just mentioned felt great about their situation. They did feel great about getting help. But we know all of this is essential work. In our work with the Arizona National Guard, it was identified that there were two main issues in the lives of service members who died by suicide. They were relationships and financial issues. As soon as we understood that, we directed a whole ton of resources at that issue, both of those, and saw a turnaround, a major turnaround. So why are these determinants of health so important? Because left unresolved, stressors in some combination of these produce misery and are the reason people kill themselves. Over the last decade, Arizona veterans have doubled the rate of suicide over the general population. So if we as a community, if I as an individual don't ensure that someone I know has a pathway to try and resolve these issues, I have not done right by them. I do not have their back. I am not using best practices for my profession, for my clients, as a licensed professional counselor, as an LCSW, as a case manager, as a peer support specialist, as an HR representative, or anyone in the veteran serving field. Our goal is to make Be Connected the widest possible door that we can, to make it a welcoming place where people can get help and support that they need. We made the path simple. One phone number, over 3,000 vetted resources that are your resources, your organizations. That's who we refer to. That's infinite amount of support and infinite amount of connections, one person and one family at a time. I'll say it one more time in a slightly different way. When we ignore the social determinants of health, we are ignoring misery. We don't need to do that in Arizona. We have Be Connected. You are Be Connected. All the folks on this conference call are Be Connected, and so many more. So with this in mind, what are we doing presently and what's coming next for Be Connected? Well, This is an illustration of our upstream prevention approach for Be Connected, because there is no one singular cause of suicide. It's not just mental health, it's all the other different things. We can't approach this with a singular solution. This three-layer approach is focused on the community at large, also the high-risk segments of the community, which we've been able to bore out with data, and individuals that we have been identified. There's another way of looking at illustrating our upstream prevention approach. This is a portion of our logic model. It's much bigger than this, but this is a portion of it. And how we want to engage our service members, veterans, and their families. We want to increase their access to care and support, connection to resources, improvement in social determinants of health and social connectedness. We also want to decrease the risk factors, suicidal ideations and attempts, and ultimately the disparity in the rate of veteran suicide. Remember, it's 2 times the general population. With success, we will have a community of service members, veterans, family members, and helpers who can mitigate risk through awareness, utilization of resources, so that they can build resilience to weather the challenges that life presents. It's a good plan. While this work is going on every day with Be Connected team at large, we have 2 specialized grant-funded projects here in Arizona. One is a 3-year Department of Defense funded project with the Arizona State University College of Health Solutions. This is focused on cross-cutting prevention within military settings. This is with the partnership of the Arizona military entities around the state. And we are developing a model for DoD, Department of Defense, to reduce harmful outcomes for service members and their families. That's one project. The other is our 3rd year of grant funding from the CDC and CDC Foundation as part of their Veteran Suicide Prevention Evaluation Demonstration projects, which has been instrumental in building our capacity to conduct data and evaluation activities. This year, we are conducting an outcome evaluation on our Be Connected risk reduction strategy that we just shared with you. So everything ties together really nicely. So why does this matter? Systems-wise, social determinants of health matter. The estimates are that 60 to 90% of health outcomes are driven by social determinants of health. What that means is that even with the best health care available, if we don't collectively attend to the needs people have, the outcomes for that care will be affected. I ask you to really think about that concept as it relates to how easy Be Connected is to utilize. It's not that much of a hurdle. Why does it matter to people? Well, here are 3 examples. And honestly, we've got thousands of comments like this from when we've connected folks to your resources. And then they see how easy it is, how we've been able to navigate them to what you're providing. The first one was from a widow, and she needed FEMA assistance. How often do you hear about that? I am forever grateful for all you have done for me. I will never forget you and how much you changed my life. A veteran who needed medical equipment. My husband has Asperger's, and I have 12 children. I could not have done this without you, Be Connected. A veteran who needed food, car payment deferral, rental assistance. He said, prior to speaking to you, I was feeling hopeless. That's not a good sign. I feel so relieved you have made such a difference. Look, believe me, as a therapist, as a human being, right? I know nothing is foolproof and there are no cure-alls. But if you believe in upstream suicide prevention, if you've ever said, what more could have been done, please consider my comments today. Thank you. And I'd love to be able to move on to our panel discussion and see what everybody has to say. All right. So please remember, everyone, that the speaker bios are in your packet and in the speaker zone of this site. I think we'll probably throw the link out, or a little pathway to it. This is like a conference center, right? With us today, we have the directors and associate directors of Arizona's 3 VA health centers. We have Alicia Smith, we have Jennifer Gutowski, and Steve Sample. We also have our Veteran Benefits Office Director, Chris Norton. we have Jamie Snyder, the Director of the Arizona Healthcare Cost Containment System. And I believe you already know Director, right? We greatly appreciate each of you joining us today. And, really on a personal note, I think of each of these people like a piece of wood with a fine grain. They're great on panels. Waiting 6 months to do that one. All right. Okay. So I'm going to jump right into this. Alicia and Jamie, I'm going to throw the question to the two of you first. I suppose we'll go with Alicia first. What do we want Arizona's veteran healthcare to look like 5 years from now? Please, you can give a quick word of introduction and welcome. But what do we want Arizona's veteran healthcare to look like 5 years from now?
Well, good morning to you, Thomas, and to our other panelists and to the audience. And thank you all for joining today. I think this is, as the director for the Phoenix VA healthcare system and one of the directors in the state of Arizona here, I think this is a great way to start our discussion. And so I'm happy to share a few thoughts. I would say that for the future, VHA would want for our Arizona veterans, our future will include modernized healthcare experiences that are outlined in the Air Commission report. And that includes things like modernized healthcare through modern facilities, connected care, so expanding and optimizing our technology for virtual and telehealth care, which includes bringing care to the veteran where the veteran is. It could be in their living room, it could be anywhere across the state or actually across the country for that matter. And then enhancing things like remote monitoring to improve clinical outcomes. In addition, I believe there's going to be an even greater emphasis on whole health care that's focused on the whole person and that integrates physical health care with mental health care for the veteran's well-being, all while putting the veteran at the driver's seat. And certainly the goal would be continued effort and emphasis on reducing healthcare disparities for all of our veterans and partnering with resources across the state, many of which we're going to hear more about or learn or hear from even during this conference to make the veterans experience more seamless, but to make sure that they're aware of the other resources that are available to wrap around them for their support, their care, and their well-being. And I think there needs to be continued focus on public information campaigns to make sure that we get the word out to our veterans.
That's great. That's I loved for those of you who haven't been able to, is the Air report, is that publicly available?
It is. It's actually available for public comment now, and that's the asset and infrastructure review that was initiated across all of VHA.
Yeah, I tell you, for folks that have an interest in kind of where the potential of things are going, that's a great report. I know you referenced it, and so I appreciate that being brought into that. We can send that out to the attendees. It's fantastic. Thanks, Alicia. Absolutely. All right, Ms. Snyder.
Thanks so much, Thomas. Alicia, I think you captured it perfectly. My name is Jamie Snyder. As Thomas mentioned, I serve as the director at Access. We serve now over 2.3 million Arizonans, so 1 in 3 Arizona residents. And when I think about what the veteran healthcare system will look like in 5 years, my thoughts are very much in line with Alicia's. First I'll start out with the partnership that we've worked to build with the Arizona Coalition for Military Families, the Veterans Administration, and the Department of Veterans Services over the course of the last many years. Going into the future, I anticipate that partnership will continue and will result in coordination that's even more seamless in nature than maybe what we've seen today. Knowing that you offer resources for veterans that are really tailored to meet the needs of veterans and service members as well as their family members. But very much in line with Alicia's comments, I really see a healthcare delivery system in the future that is focused on meeting individuals where they're at, whether that's offering services through technological means such as telehealth, in-home remote monitoring, ensuring that students are able to access services, so family members are able to access services in school, behavioral health services as well as physical health services, rather than having to go off campus to a freestanding clinic location. Ensuring, most importantly, as you mentioned, Thomas, that we're attending to individuals' social service needs. What we know is that 80% of an individual's health outcomes are tied to something other than their clinical care. And so as a Medicaid agency, we not only focus on the provision of clinical care, but we focus on connecting individuals to critical social services. And for veterans and family members and service members, that resources be connected. And so it's our commitment, the commitment of the agency and the health plans that we contract with, that when we encounter a service member, a veteran, a family member, that we are connecting them to that critical resource, be connected as their sort of one-stop shop in terms of accessing resources, again, that are really tailored to the needs of veterans and their family members. So again, we just really appreciate the partnership. I think we have a very bright future ahead of us, and we'll continue to coordinate with your organization, Thomas, and Colonel Wright's organization, and Alicia as well.
Thank you, Jamie. I appreciate those words, and I really like how you talked about the seamless coordination and the meeting folks where they're at. It's because I almost had an image of students being in there wherever literally wherever you happen to be, being able to use telehealth and those kind of things. And I know that's a lot of that technology, and certainly during COVID, has been kind of advanced forward, maybe a few years at least, maybe a decade. But I don't know. I just had this really nice image of being able to have access to care whenever and wherever. That's just a neat thought. All right, cool. Okay, so we're off to a really good start. I'm going to come over to Chris Norton. And, from your perspective, you've got a really interesting role in this, because we talked about this as kind of healthcare leadership, right? And, but interestingly, you are an integral part to that. You've been offering kind of social determinants of health support for, I don't know, how long? Decades, centuries, something like that. Yeah. Not you personally, but, but the benefits office. So, from your perspective, as the director of the Regional Benefits Office, why is it important to embrace and advance social determinants of health practices?
Great question, Thomas. And first, let me say it's fantastic to be with you again. Again this morning, as with all of our panelists, when you say that it's been 5 years of Be Connected now, that really drives it home. That it's gone by so quickly. I believe I arrived here in Arizona just before we kicked off, and this is my fifth opportunity to join you with this, and I can't wait to see you all again in person. But to get to your point, essentially the VA Benefits Office has always supported the social determinants of health, particularly looking at it from a financial perspective. Our services that we offer, such as compensation, pension and fiduciary, insurance, education, the home loan guarantee program, and veterans readiness and employment, directly support a veteran's social needs, and in many cases lead to eligibility for healthcare benefits they may not otherwise receive. The expansion of our efforts to include our state and community partners and resources through Be Connected only adds to our longstanding effort to support our veterans. What I'd like to see going forward is continued improvement in the way that we provide benefits to our veterans and their dependents, and most importantly, our returning service members. In 2020, the VA implemented our Solid Start program, in which representatives from our National Contact Center reach out to all recent veterans proactively at the 30-day, the 180-day, and the 1-year mark after their return from service to discuss any needs they may have in terms of mental health services, compensation, education, home loan assistance, really any area where they may qualify for services that we offer. We believe that if we can cultivate upstream support in providing the assistance our returning heroes deserve, we can better prepare them for the challenges that await them as they reintegrate into their civilian life. I believe that as we look to reach our separating service members and ensuring a smooth transition to our veteran population, this will afford them even greater opportunities to work with our community partners to provide a holistic approach to addressing the challenges our veterans face.
That's great, Chris. Yeah, it's especially you're right, especially on the financial side of things with home loan. I know I did that when we didn't have enough money to saved up to put a down payment on there. Unfortunately, the house that we purchased was owned by a Marine, and he was like, "Oh, okay, a Marine," and he went along with it, and he said, "Yeah, let's do this." We found out later he had other contested, other higher offers. And he said, no, I'm going with them. And,
Right.
So that was a connective thing, but it was also really important in the early stages of Nicola and I's marriage. So,
Sure.
that's the type of thing that your office helps to support.
Absolutely.
So, kudos to it. And we absolutely, we want to tie more, beautiful point. We want to tie more exiting the service members
Mhm.
into the benefits office earlier, and of course the health centers as well.
Indeed.
It's hugely important, massive way of preventing things in the future from.
Absolutely. Right.
All right, awesome. Okay, so Jennifer and Steve, so I mean, each of your health centers covers these like massive swaths of rural area, and with massively diverse populations, and in some cases many disparities between what's available and the resources in the particular area and those types of things. So I guess what needs to happen in order to advance the ecosystem of support for veterans in the communities that you serve? What would you like to see happen? Given the, and Jennifer, I'll go with you first. You've got, the city of Tucson. That's no small city. And so you've got kind of this mix of both urban and rural. So
We do.
go for it.
Yeah, no, thank you so much, Thomas, for having us as part of this session today. And what I want to share first is just a little bit about me. What's not in my bio is that I'm a daughter of a Vietnam veteran, and my dad gets all of his care from the VA. So it's professionally and personally important to me, the work that we're doing and the work that we're doing today, because I really believe the VA can't do it alone. And it's sessions like this that give us the opportunity to be connected, to share what resources are available. And that's the key point of these rural areas and stretching across Southern Arizona from Yuma to Casa Grande to Sierra Vista, Safford. That's a large area to cover. And there are so many amazing already established partnerships that we have. And I bet so many more that we can be able to establish. We have our partnership with the DAV that helps us with our transportation network. I'm so excited that you're going to be hearing from Kristen Ellis, who's part of our nutrition and food team. And I guess I also want to point out the power of one. And our nutrition and food team recognize that veterans were experiencing food insecurity, particularly as they were coming out of the hospital and not having the food necessary for healing when they went home. And this amazing team have figured out how to provide food, healthy food for our veterans when they're leaving, and provide a warm handoff to community resources such as Be Connected and navigators that will help continue that effort on the outpatient setting. That is magical. And I think that as all of you listen today, don't hesitate to bring forward an idea, because the power of one, I'm already getting chicken skin, can really make a tremendous difference. And next thing you know, we're weaving that network closer together and providing that support network. I don't know if folks realize it, but the VA also can provide gun locks free. And as we know, gun locks, when firearms are stored that are locked, there's a lower risk of suicide than those that are unlocked. And so let us know, what can we do to help partner? Again, I don't think the VA can do it alone. So I'm just really excited to have a forum like this where we can all connect and figure out what ideas are out there, and let's try them, because that's what it's all about. Thanks, Thomas.
Thanks, Jennifer. I love that you brought in some specific examples of intervening with social determinants. The food insecurity thing. I was reading some analysis from our data team out of ASU just a couple of days ago that talked about that food insecurity and homelessness, actually in that order, are the two primary disruptors of physical and mental health. And when you start to resolve those two things, it only makes sense. We all know this kind of thing, naturally, but that health improvement rates go dramatically improve after that. So love that type of effort. And I also always love hearing you say chicken skin instead of goosebumps. That's awesome. All right. Thanks, Jennifer. All right, Steve, what are your thoughts? What needs to happen?
Thomas, that's a great question. That's something, like down in Southern Arizona, there's a lot of rural areas. There's a lot of rural areas in Northern Arizona. So our catchment area for Northern Arizona is 65,000 square miles, which is a huge distance. And so travel is one of the biggest challenges that we have for our veterans. But it's not something that the VA can solve alone. We really need partners, and we need the support from the community. And I think through Be Connected, it's really helped us do that. I mean, I remember back, I guess 5 years ago, since you pointed out it was 5 years ago that this started, going to the very first meeting. And I went with Jennifer. It was at the U of A when you had the first meeting down in Southern Arizona. Going and we're thinking, okay, what is this? And what's the ask for the VA? And it turned out to be a great partnership. I mean, it really brought the three VAs closer together. It brought us the connection through Chris and his office, which really is helping our veterans. And then as you all built out the partnerships and the connections in the community, that's really been beneficial for us. But specifically, when we look at some of the things that we do related to the social determinants, we focus on areas that we can impact. And, clearly it takes an ecosystem to do that. And there's some things that the VA is very good at, some things that we're connected with. And so those are the ones that we focus on. But we also have staff here that we use as peer support counselors that are really Be Connected counselors that do those warm handoffs to your team where we can't provide those services. But here this year, we have 416 HUD-VASH vouchers, which is 416 veterans that we're able to place. Now that's mostly in Yavapai, Coconino, and Mojave County, but still that makes a huge difference. And I think across the state, as we look at housing, and really across the country, but specifically across the state, the cost of housing has really skyrocketed. So that's really important for our veterans. But housing alone isn't the only thing. We really have to focus on some of those employment opportunities to get our veterans engaged with employment. So we have employment counselor specialists that help connect veterans with employment opportunities. And I think that that's really, really been beneficial. If I go back to probably the biggest struggle that I hear about, and that's really transportation. And I mentioned the 65,000 square miles, which is a challenge for us to provide services, but it's also a challenge for our veterans to get those services. When I look at Northern Arizona, 79% of our veterans live within a 30-minute drive time of one of our points of care. So whether that's the main campus in Prescott or one of our CVOCs at Lake Havasu, Kingman, Anthem, Cottonwood, or Flagstaff, or one of our other points of care, that works for them, but it doesn't work for everybody. And I know Dr. Smith earlier mentioned kind of some of the advancements in video and VVC connectivity, and that's really been a force multiplier for us. And it also helps solve transportation needs for many veterans because they could connect virtually. And there's some advantages of that. You get great quality care. We all talked earlier about the advancements that COVID brought along with that technology and moving that forward very rapidly. I think that that's been beneficial. But there's the side benefit is if you normally had to pay a copay, if you're using a VVC appointment, you don't have to pay that copay. But for all of our veterans, that doesn't work. So some of the challenges that we have, again, in Northern Arizona, and I know it's true in parts of Southern and Central Arizona, quite frankly, really gets down to bandwidth and connectivity. So even though the technology is available, the medium by which to connect isn't there. So really, I think one of the things, in addition to transportation, that we need to focus on to help our veterans and to help all Arizonans is really to increase the bandwidth. The connectivity across the state would really be beneficial. It brings people closer together because then they truly are connected. So thank you, Thomas, for the opportunity to make some comments.
Yeah, thank you, Steve. You know, I do think, having been a resident of Northern Arizona myself years back, I do think about just the huge portion. I think it's like 60% of the state, you know, or somewhere around there is about how much, you know, you're attempting to manage. And the connectivity, I know the connectivity, Jennifer, in your region as well is you know, struggles. And so, yeah, I keep thinking about, you know, how that plays itself out. Wanda, do you have any thoughts about that? I know, you know, Governor just
I have lots of thoughts.
Yeah.
So,
and are they like, if they're me, then the thoughts are spelled TWAUT, thoughts, you know, something like a Pooh Bear would, you know. But for you have official thoughts, so let's go with that.
I love Jennifer's, you know, it takes one, and I'm the one in our department that has a billion ideas, and I have to stop myself, otherwise my staff gets overrun. But yeah, I have quite a few thoughts. You know, all of the directors have spoken about barriers to access, I mean, in general terms. And
Yep.
As we identify those, I feel it's my department's responsibility to support them in reducing those barriers. So transportation, for instance, we worked with U of A to do a study last year to work with the Association of Governments, the county governments, to try to figure out where the biggest challenges were. The coalition did a D2D door-to-door pilot that also brought us some data. And now I feel very comfortable about maybe presenting some legislation next year to our state representatives to maybe work on some solid transportation processes or programs that can support not only veterans, but all aged citizens in their ability to get to their appointments. The other idea that we've come up with recently, and which I find interesting, we're able to use the marijuana money from the state coffers now because it's recreational, marijuana is now legal, is our ability to get to that last mile. So you've talked about the broadband. The state has been working on trying to get the cable companies to work together to get to that last mile. And then even on the sites, if they don't have the technology to use it, it doesn't matter. So we put together a program that allows us to bring the technology to particularly the tribal veterans to access telehealth and to access speaking with our veteran benefit counselors to, one, file a claim for pension or disability, or to be referred to Be Connected. And so I always hear and listen to what we're saying in our Be Connected network meetings. Alicia has an executive committee meeting that I go to. I try to go to the VSO meetings to hear where we're missing things. And then if we have the flexibility, we will create some sort of pilot to test things. And if the pilot works and is successful, we can generally speak to the state about, hey, let's try to fill in some of these gaps. Jamie's been a great help in helping us do some of those things. We're working right now on housing. And there's a big project that the state's working on to try to support housing for the general population, as well as veterans. So that's, I guess, my sort of future ideas that we'll be able to elevate that as we continue working together with one another to figure out where we can really synergize those things where maybe VA can't do, but maybe Access and the Veteran Services can do. And all that together, we can really reduce the barriers.
I love that, Wanda. I think you've really talked about and nicely segued with Steve's comments about, you know, just the difficulties and that we have to solve this in a variety of different ways. And that's what, you know, just as a you know, just a regular community person, it is cool to see this conversation happening. And then to hear, okay, well, yeah, you know, we may be able to do something about it legislatively. Yeah, it's neat to see us kind of all problem solving in a broader way. So one of the things that I wanted to introduce here, I've got a video that we produced. One of the initiatives that we're really working on, you know, thanks to Jamie, is to ensure that we're outreaching and connecting with every veteran. You know, this was kind of the year of really ensuring that we're connecting to every single veteran in the state at least once, for, you know, even if half a minute, through our commercials on TV and radio and things like that. Social media and whatnot, because part of it is just getting the base knowledge to people about what's available, and that there's a whole sea of folks that are just waiting to support them. So if we can play this video, this is a specific outreach video that will be for Access members who are veteran affiliated, right, family members, or who are veterans themselves, and maybe either loosely connected or not fully connected to the VA, or for a variety of different reasons. Maybe they've got bad papers or something like that. They're with Access. And so we want to show this, and then maybe I'll have Jamie and then Wanda and then anybody else make a comment on that afterwards. All right, Jeff, take us away. The amazing thing that is happening today is that there are a remarkable number of resources, services, and benefits for all service members, veterans, and their families.
Access, one of our great government departments, is responsible for medical care, mental health care. But we've found that there are a lot of other social determinants of health that our veterans need. In our partnership with Access, we recognize that there are gaps for veterans, and Be Connected can help fill those with all the myriad of resources that they have. We want all of our veterans to have the best life that they can have.
One of the ways that we've tried to make it very easy for you to access really high quality, vetted resources is by ensuring that there is no wrong door for you to enter in which to be able to receive services and support. The best way to get to those doors is by contacting Be Connected.
When you call in to the Be Connected support line, you are not going to get someone that's on a timer. You're going to get someone that genuinely cares and understands. I am an Army veteran myself. You're going to get someone that is genuinely passionate about helping you and is going to go that extra mile to make sure that you get, whether it's a resource or just the support, that you have someone that's with you to work through whatever you are facing.
All right, Jamie, Wanda?
Absolutely. I mean, I think the video really says it all, right? It's so fantastic to have, again, kind of a tailored resource for service members, veterans, and their family members. We've been focusing at Access a lot of energy and effort recently around connecting the members that we serve to needed social services. And we're thrilled to be able to have this resource specifically for veterans, again, family members and service members. And so just really appreciate the opportunity again to partner with you, Thomas, in that effort. Our health plans are engaged as well around ensuring that we're connecting folks to be connected as that single source of information.
Yeah, we've had a long-standing partnership with Access since the very beginning. And if you all remember Tom Betlak, one of our first asks was to have you served on the application process. And he did that for us. And I always appreciated that he was so flexible in doing that. That's forms, right? When you change forms, it's not an easy thing. And it's a whole process you have to create around it. And since then, Jamie's really elevated it. Now that there's been change in the way sort of Access does healthcare, in that now they have plans and those providers within the plans, sort of just her commitment to be connected really has shown itself in the way the providers are managing care for veterans. And that just goes to show where we came from and where we are now, that we have so much more access to the system to support veterans. I can't, like she said, you can't really say much more than that.
No, but that's saying a lot. So, this is music to my ears. I'll just, in kind of in a little bit in closing of this, I'll say, when I got out of the service, I knew what I wanted to do. I wanted to, get my degree, and then I wanted to go back into the Marines. I wasn't able to do that because of a bout of cancer. And so I turned my, professional aspirations towards kind of my second career choice, which was to go into the mental health field. And so I went and got my, therapists, all the certifications and licensure and all that good stuff, and started practicing. And the thing that I struggled with the most, because I worked with, Access, clients, I worked with VA clients, I worked with folks that, were non-veterans and, just regular, community members in every possible capacity, acute psychiatric care, residential treatment, you name it, for chemical dependency, you name it. And the big struggle was always to try to find, where do I go? How do I manage this? How do I get folks? We could get someone, sober in a 28-day program, no problem. That was relatively easy. It's a challenge, but that was, we knew what we were doing in that case. Creating an effective aftercare plan, forget it. It just didn't exist at that time. Things obviously got better over the course of time, but when I look at the strength of these connections, when I hear multiple, all three directors of 4 with a benefits office talk about how we're stronger because of Be Connected just within the VA, then I think about attaching the other major healthcare system, which is Access, and incorporating that into, Jamie, your primary wonderful word was doggone it, I just had it written down. That word go. Seamless coordination. That's what you said. Perfect. That's what we're after. That's what our service members, veterans, and their families deserve. And I think with this crew, we're going to make it. All right. Really appreciate it. Jennifer, Alicia, Chris, Jamie, Stephen, Wanda, you are all awesome. You are perfect panelists. So the highest grain of wood that you can possibly imagine, you guys put the bill. And I think I will pass things over to Dee at this point.
Thank you, Thomas. As you can see, we have a great day planned for you. I'd like to help you kind of navigate our virtual platform today. But before I do that, I really want to take a moment to give a special thanks and a note of gratitude to the Governor's Office of Youth, Faith, and Family, as well as the Arizona Healthcare Cost Containment System for their continued partnership and support. As you heard on our panel, the directors all shared the topics that we are going to be talking about today. And what's exciting is that you are going to have a chance to share and go through solution sessions after you hear the experts and the frontline workers speak about these topics. So I just want to reiterate that you've completed the first general session of our 2-day event. Our next thing that will be happening is that we'll have 2 breakout sessions with 6 options each to choose from. So at this point, I'd like to show a video to help you guide and navigate this platform.
Welcome to our video guide that will walk you through the online event platform for the upcoming virtual 2022 Statewide Symposium. We are excited for you to join us on April 20th and 21st for our 12th annual symposium. First, type in the URL www.acmfeventcenter.org onto your web browser. Next, you will see several images for online presentations. Find the 2022 ACMF Symposium image located on the top of the page and click Join. Once you have joined the 2022 ACMF Symposium, you will see a virtual mock-up of the Desert Willows Conference Center. There are several ways to navigate this page. You can do one of the following action items and they will all take you to the same location. Option 1, click on the entrance sign. Option 2, click on the word lobby in the gray toolbar at the top of your page. Option 3, click on the enter the lobby button located at the bottom of the page. Once in the virtual lobby, you will see the tabs at the top of the page, as well as the podium in the center where you can access the various virtual rooms and information in our presenters and sponsors. The agenda tab will provide all the information about the event with session titles, times, presenters, and a brief session description. Then we have the General Sessions tab, where you can directly join the Day 1 or Day 2 general sessions. After the general session, we have the Breakout Sessions tab. Here, you will see all the session titles and times for the first and second briefings on both Day 1 and Day 2 of the symposium. Each session has a link to join it. Lastly, in the Presenters tab, you will see the bios of each presenter at the symposium. Thank you for joining us at our 12th annual ACMF Statewide Symposium. We want to let you know all recordings of general sessions, breakout sessions, and solution sessions will be uploaded to the platform within a few days after the event ends. Visitors to the ACMF Event Center platform will also have access to not only the session recordings, but resource guides and slide presentations for some of the sessions. Again, thank you.
All right, so hopefully, again, you'll be able to view the video. I'm going to put that in the chat box for everyone to navigate if they want to review that again. We will have a short break before starting our next session, but I wanted to reiterate some of the questions that have been coming in through the Q&A. We will follow up with those answers if we haven't directly answered you. There was some mention about various things about mental health services, what is available, numbers of veterans being seen, not being seen. So again, we will follow up and get those data points back to you. And I just want to know that many of these topics are going to be covered in your breakout sessions. And just a reminder, we'd love for you to join us back at 11:40. That will be our closing session for today, our general closing session today. And again, you'll just navigate back to the general session. Thank you so much.